Is masturbation after 50 a silent friend or a hidden enemy? Dr. Emily Carter poses a personal and honest question to men aged 50, 60, or even 70. In quiet moments when they find themselves alone and have engaged in self-stimulation, have they ever stopped to wonder if this practice, which perhaps has been with them all their lives, is still truly healthy and beneficial at their age? Or perhaps in the solitude of their thoughts, a subtle worry has crept in, a private doubt about whether they might be causing some kind of invisible harm to their body, their prostate, or their hormonal balance. If these questions resonate with them, Dr. Carter wants them to know something fundamental. They are not alone. This is a topic covered by a cloak of silence, surrounded by outdated myths and, above all, an alarming lack of reliable, humane information. In a world where everything is openly discussed, the topic of male sexuality and maturity remains a taboo, a conversation many prefer to avoid. And why is there so much uncertainty? Because even though science has advanced enormously, research on this specific topic is scarce, and the available data doesn't always reach those who need it most. Studies indicate that a large majority of men over 60 continue with self-stimulation, but many do so blindly, unsure of the true effects on their bodies. They wonder if it's a habit they should abandon, or if, on the contrary, it's a vital part of their well-being. Therefore, today, Dr. Carter will facilitate a conversation that is urgently needed. A conversation based not only on science, but also on empathy and an understanding of the human experience. She will guide viewers through 10 surprising and profound benefits of masturbation in maturity. But to provide a complete and honest picture, she will also explore 5 potential risks that men must be absolutely aware of. The goal is to empower them with knowledge so their practice becomes an act of awareness, not doubt. Let's start with the good news. The 10 profound benefits of masturbation in maturity. 1. Maintains penile health, a gym for the corpora cavernosa. The penis is a vascular organ, not a muscle, but its health and function critically depend on blood flow. The act of achieving an erection is, in essence, a vascular exercise. During an erection, the corpora cavernosa, which are the spongy tissues inside the penis, fill with blood. This can be thought of as a form of physical therapy or regular training for the penile circulatory system. As men age, the arteries supplying blood to the penis can become less elastic and narrower, a process known as atherosclerosis, which also affects the arteries of the heart. If the penile tissues do not fill with blood regularly, they can begin to lose their elasticity, becoming fibrous and less able to expand. Regular masturbation ensures this blood flow remains active, which helps preserve elasticity and erectile function. It's like keeping a muscle active to prevent atrophy. It's not just about the erection itself, but about maintaining the entire vascular ecosystem of the area. 2. Promotes prostate health, the flushing of waste. This is, without a doubt, one of the most science-backed benefits. The prostate is a small but crucial gland responsible for producing seminal fluid. Throughout life, potentially harmful substances can accumulate in the prostatic ducts. Multiple large-scale studies, including the aforementioned one from the Harvard School of Public Health, have investigated the relationship between ejaculation frequency and the risk of prostate cancer. The study, which followed nearly 32,000 men for 18 years, found that those who ejaculated 21 or more times a month had a 31% lower risk of prostate cancer compared to those who did so between 4 and 7 times a month. The most accepted theory is that regular ejaculation helps flush out carcinogens or pro-inflammatory substances that could contribute to tumor development. In essence, ejaculation acts as a natural wash or purge for the prostate. It is a simple and effective preventive act. 3. Strengthens the pelvic floor. The foundations of sexual and urinary function. The pelvic floor is a group of muscles that act like a hammock, supporting the bladder, intestines, and, in men, the prostate. These muscles are vital for erectile function, urinary continence, and ejaculatory control. During orgasm, these muscles contract rhythmically and involuntarily. These contractions are like the most intense Kegel exercises one can do. A strong pelvic floor is synonymous with greater control. For the aging man, this is crucial. It helps prevent urinary incontinence, an embarrassing and common problem. Furthermore, a strengthened pelvic floor can improve erection firmness and control over ejaculation, which translates to greater confidence and sexual satisfaction, whether alone or with a partner. 4. reduces cortisol, the antidote to chronic stress. In our modern world, stress is a silent epidemic. Chronic stress raises levels of cortisol, the stress hormone, which can lead to increased blood pressure, systemic inflammation, and a weakened immune system. Research has shown that orgasm leads to an immediate and significant drop in cortisol levels, while releasing endorphins and serotonin, neurochemicals that induce relaxation. Consider a 60-year-old man who has had a difficult day, full of work pressures and financial worries. A session of self-stimulation not only offers him physical release, but also acts as a potent biological regulator. By reducing cortisol, the body can enter a state of rest and digest, which is beneficial for cardiovascular health, the nervous system, and overall mental well-being. 5. Releases a cocktail of wellness neurochemicals, a natural chemical boost. The brain is the largest sexual organ. Orgasm is not just a physical event, it's a chemical flood. Orgasm floods the brain with a series of beneficial neurochemicals that act as a natural mood enhancer. Dopamine, known as the pleasure and motivation molecule, spikes, creating a feeling of euphoria and reward. Oxytocin, often called the bonding or love hormone, is released, providing a deep sense of calm, connection, and well-being. For an older man who might be dealing with loneliness or depression, this chemical boost is invaluable. It can improve mood, reduce feelings of isolation, and provide a sense of emotional well-being that is fundamental to robust mental health. 6. Aids in self-assessment of physical problems. The Health Watch. Masturbation forces intimate and regular contact with one's own body. This constant self-examination is one of the most effective and preventive ways a man has to detect early signs of serious conditions. A man who self-stimulates regularly becomes familiar with the texture, shape, and sensations of his testicles, penis, and a surrounding area. Dr. Carter has seen this in her practice. She recalls the case of a patient named David, a 62-year-old man who came to her office. He had noticed a small, pea-sized lump on his left testicle during one of his self-stimulation sessions. Although it caused him no pain, the fact that the lump wasn't there before alerted him. She performed an ultrasound, and it was indeed a testicular tumor at a very early stage. Thanks to his conscious self-exploration, it was able to be removed with minimally invasive surgery, with an excellent recovery prognosis. His act of self-stimulation was not just a moment of pleasure, it saved his life. 7. Improves sleep quality, a natural sedative. Insomnia and sleep problems become more common with age. After an orgasm, the body releases a combination of hormones that have a sedative effect. Prolactin is released in large quantities after ejaculation, which has been associated with a feeling of relaxation and drowsiness. Combined with the drop in cortisol and the release of oxytocin, the body enters a state of deep relaxation. For many older men, a masturbation session before bed can be the key to falling into a deep, restorative sleep, something that often becomes a luxury. 8. Improves overall pelvic blood circulation. The pelvic ecosystem. The circulatory benefits of masturbation go beyond the erection. The increased blood flow extends to the entire pelvic region, including the muscles, bladder, and prostate. Good circulation is vital for the health of all these organs, ensuring they receive the necessary oxygen and nutrients, and that waste products are removed. It prevents congestion and stagnation, problems that can contribute to erectile dysfunction and other health issues. 9. Serves as a training method for ejaculatory control. The personal lab. For men struggling with premature ejaculation or who wish to prolong pleasure, masturbation is the perfect gym. It provides a safe, private, and pressure-free environment to practice techniques like the stop-start method. By masturbating, men can explore their body's sensations and learn to recognize the moments just before the point of no return. This allows them to develop greater control over their arousal and ejaculation. This knowledge and control can then be transferred to sexual relations with a partner, improving mutual satisfaction. 10. Keeps sexual desire and neural pathways active. The brain is still a muscle. The brain is the epicenter of sexuality. Desire and arousal are complex neural processes that are activated and maintained with practice. By regularly engaging in sexual fantasy and physical stimulation, men keep the neural circuits associated with libido and sexual response active. Imagine a path in the jungle. If it's not used, vegetation covers it. The same happens with neural circuits. If they aren't activated, they can become dormant or less responsive. Regular self-stimulation ensures that the neural pathway of sexual desire remains clear and active, which helps maintain a healthy libido and the capacity for sexual response even without a regular partner. The 5 risks of masturbation in maturity that men must know. 1. Social isolation. When masturbation replaces intimacy, the risk lies not in self-stimulation itself, but in the role it plays in life. Becomes a problem when it stops being a healthy part of sexuality and instead transforms into a substitute for human connection and real intimacy. Masturbation can become such a comfortable and predictable refuge that one begins to avoid the vulnerability and effort required for an intimate relationship with another person. The problem is when masturbation becomes the only channel for sexual and emotional expression. The older man who withdraws from social life avoids dating or connecting with his partner and settles for self-stimulation as his sole source of pleasure is at risk of isolation. The solution is not to stop masturbating, but to be aware and ensure this practice complements life, not allows an escape from it. 2. Risk of microinjuries and skin pain. This risk is purely physical and easy to avoid. As men age, the skin can become thinner and less elastic. Aggressive masturbation or the lack of proper lubrication can cause small lacerations, irritation, or inflammation on the penis. These microinjuries are not only painful, but they can also become an entryway for infections. The solution is simple and crucial. Always be gentle and use a quality, water-based lubricant. The skin will appreciate it. 3. Desensitization and difficulty with a partner. If a man always stimulates himself the same way, with the same pressure, rhythm, and fantasy, his brain can become conditioned only to that specific type of stimulation. This can create a desensitization problem where a partner's touch, which is softer and more variable, may not be enough to cause arousal or orgasm. This can generate frustration and anxiety in both him and his partner. The key is variety. Varying the technique, rhythm, fantasy, and focus keeps the brain and body flexible and adaptable to different types of stimulation. 4. It can mask underlying medical problems. This is a serious and often ignored risk. If a man achieves a firm erection during masturbation but not with a partner, it's easy to assume the problem is psychological or that the chemistry with his partner has disappeared. However, this pattern can be a warning sign of serious underlying health problems like heart disease, diabetes, hypertension, or hormonal imbalances. Dr. Carter remembers a patient she will call Robert, 54 years old. He couldn't get an erection with his partner but had no problem with masturbation. He thought it was stress. She encouraged him to get a full checkup. The results revealed high cholesterol and borderline high blood pressure, problems that were affecting blood flow to the penile arteries. Erectile dysfunction was the first sign. Ignoring it and continuing to masturbate would only have masked a health problem that required immediate attention. If men notice this pattern, Dr. Carter urges them to please consult a doctor. 5. A disconnection from reality and unrealistic pornography. In the digital age, access to pornography is unlimited. If masturbation becomes heavily dependent on extreme, unrealistic, or violent pornography, it can skew expectations of human sexuality and make real intimacy with a partner unsatisfying. Pornography presents an idealized world of sex without wrinkles, without imperfections, and without the complexity of human emotions. This dependence can create a dangerous disconnection between fantasy and reality, making it difficult to connect with a partner. The key is balance. Men should use pornography moderately and ensure that their own imagination and real experiences remain the primary source of their desire. As viewers can see, masturbation after 50, 60, or even 70 is not simply good or bad. It is a powerful tool, and like any tool, how it is used determines its effect. The secret ingredient, the one that unites all these points, is awareness. Practiced with awareness, respect for the body, the mind, and with moderation, it can be a powerful ally for health, vitality, and overall well-being. Dr. Carter hopes this honest and detailed conversation has been helpful and has given viewers a new perspective. Which of these points was most surprising? What myths did they have about the topic that have now been dispelled? The discussion is richer when it is shared. She invites everyone to leave their comments and continue this important conversation together. If viewers found value in this deep exploration, they are encouraged to please like and subscribe for more simple, science-based, and genuinely human advice on health and maturity. Don't forget to press the notification bell so as not to miss the next conversation. Stay healthy, connected, and aware.